really delighted to be here. So I want to talk about innovations in refugee integrated healthcare that we've been pursuing since we opened the Colorado Refugee Wellness Center. Oh, I've got a clicker. But no one told me how to use the clicker. Right. There we go. So first of all, who are we? We're an integrated care clinic serving refugees and asylees, and we're located in Aurora, Colorado. We're a partnership between Metro Community Providers Network, which is the federally qualified health center in a U-shape around the Denver area. We offer highly team-based, integrated, holistic health care, and we have a focus on improving health equity and decreasing health disparities by looking at things like linguistic, cultural, economic obstacles to receiving optimal health care for asylees and refugees. Also, difficulties that people experience navigating the complex Western medicine health system. Our emphasis is on linguistically and culturally tailored services, and we work continually on improving this. Why are we located in Aurora, you might ask? Aurora is the most diverse city in the state, and in addition to that, it's considered the third most diverse in the country, believe it or not, for a city of its size, to give you an idea. It is now a minority-majority city, and 66% of our newly arriving refugees resettle in Aurora. Oops. So why do we exist, and what's our structure? I'm going to start with a conceptual blueprint for if we had the luxury of building a clinic from the ground up to decrease health disparities, how would we do that? And hopefully there are some ideas in here that you may not be serving refugees or asylees, but that you could apply in your own clinics. First, you might want to gather some community partners with a shared goal. In this case, trying to increase health equity for refugees and asylees. The supporting pillars are, in our case, primary care and behavioral health care. You want to have complementary services that you're offering together. The beams spanning the entire clinic are our guiding principles, which govern all of the different activities within the clinic. Well-integrated, holistic healthcare, team-based, and culturally and linguistically tailored services. Say that 3 times real fast. The blueprint calls for having many open doors for easy access into the clinic to be able to take advantage of the multiple services within. And the roof is where the partners join and also join with community partners to pursue shared goals broader than just medical and mental health services. So issues that might affect health disparities, like we're working on improving Medicaid transportation or access to specialty care, or in a public health campaign with the city of Aurora for immigrants and refugees. In our case, the 2 partners are, I mentioned, Aurora Mental Health Center and MCPN, and the primary activities that we integrate and work together on are, number 1, we provide the initial medical and mental health screenings for all newly arriving refugees that will be calling Aurora home within 30 days of their arrival in the country. Now, in Aurora, like I said, that's 66% of the refugees coming into our state, and in 2016, that means we screened 1,300 refugees there. This screening contract, Metro Community Providers Network has a contract with the state to cover our offering these services, and then Aurora Mental Health Center partners with MCPN on this. And then we have the ability to roll people into integrated behavioral health and primary health care within our clinic, or if that's not the most convenient clinic for them, we will make sure they establish care at another medical home. This just gives you a little bit more information about the structure and the staffing pattern at our clinic. I'm not going to read through all of this, but I am going to accent one critical feature, which is in our clinic, 24 languages are spoken by staff from 18 different countries. And that's not by accident. We take a broader view of health and illness, and we really try to address the social determinants of health. And that we do by offering multiple wraparound services in our clinic. Things like we have free legal consultation, we have health education. Banu's going to talk a little bit more about the services we offer. We help with Medicaid transportation, specialty care referrals. So to accent a few of our innovations in a nutshell, we have a highly integrated, team-based whole health approach. And by this I mean, we essentially have 3 different groups of staff members. We have the medical staff, we have the mental health staff, we have the health navigators. All of us work very closely together in real time in our clinic, and this makes for more efficient communication and collaboration patterns. The clients we see often have very complex medical and mental health conditions. They have been universally have trauma backgrounds, because to be a refugee or an asylee here, you have to have experienced persecution or threat of your life in your home country to even be able to come here in the first place. So we have that affecting both mental health, but also physical health, because we deal with torture survivors as well. And having the mental health, the medical health, the health navigation, cultural perspective on things is just invaluable when you're trying to pull apart what pieces what in their presentation. In addition, we have clients that present with culture-bound syndromes, and this basically means that many of them come from cultures where having mental health symptoms is very stigmatized. And so a culturally more sanctioned way in which you can manifest distress is through somatic symptoms. And so we'll get people in the clinic that have a particular medical presentation that may be psychologically driven, and it may vary from culture to culture. We literally see people from around the world. So it takes some working together to pull apart what's psychological, what's medical. Also, because of the high level of stigma associated with mental illness, it helps a whole lot to be located in a medical clinic where they get integrated care, because no one knows if you're sitting in the lobby, are you there for medical, are you there for mental health? And if we introduce this as our team-based model in the beginning, people just assume, well, this is healthcare in the United States. They don't know any differently, really. They see the mental health folks and the medical from the beginning. We also emphasize ongoing cultural training and adaptation of our service model regularly. And what this looks like is all of the incoming staff and students first are trained with a very cool computer program called the Virtual Patient. It was developed by Harvard and colleagues in Scandinavia. And what it does is it has a traumatized refugee patient, virtual patient, that you can interview and do a mental health and a medical assessment. And depending on the questions you choose to ask, you will get different types of responses from the patient. So sometimes if you're particularly clumsy, she'll get mad at you. If you ask in one way, she may shut down and say nothing. If you ask in another way, she opens up and tells you a bunch about her history. We also have monthly cultural trainings, and this includes everybody from the front desk staff to the back office, everybody. Every month, it's a topic of pertinence to the clients that we serve. It might be about different cultures or what are healing practices in this culture. But then quarterly, we take what we've learned in the last 3 months, and we work hard at adapting our service provision model as we're learning more and more about the people we're serving. What does this mean for how we conduct our business differently? So as an example, we run across some pretty interesting dilemmas. Like we might have a Muslim teenager, and our medical providers need to provide sexual education to the teenager, but the parents may not even want the provider to be talking to their daughter about sexuality, let alone sexual health. So then we work on how can we do this in a culturally appropriate way? We have an array of behavioral health services listed here, and what I'd like to highlight, we have services available in real time. So we have a behavioral health provider in the medical clinic that can do consults and meet with patients as soon as something's identified. Again, getting rid of that barrier to coming in, serving somebody while they're there. But in addition, somebody can just walk in the door of the clinic and say, I need mental health services, and at that point that we have somebody available to see them. Two other innovations that are a little different. Our clinic is located in our mental health center, so it's a reverse integration model. And the size of our mental health team is comparable to the size of the medical team. So unlike in some integrated models where you might have one or two behavioral health providers in a medical clinic, we have equal-sized teams, and we really push the teams up against each other and work regularly with one another. And our mental health team is composed of more health navigators from the refugee communities than it is of behavioral health providers. And Banu is now going to talk about our health navigation model.
So our health navigator model is really unique, where navigators are able to address any social, financial resources and acculturation need. We have an open door model where refugee can come in for any reason. They can say, can you help me pay my bill? Can you help me fix my Medicaid problem? I am not getting my medication. It can be anything. As we were able to help with their basic need, they are less stressed. I'll give you an example. Patient will come in, they will be like, I don't have job, I am jobless, so they were stressed with that, and our navigators helps with job application. They call the employer, they set up the interview, they do all that process, which reduce their stress. That means they will reduce the need for medical and behavior BS services. And it is cost effective because our navigators are non-licensed professionals and they are hired for low salary. If they can fix some of those problems, then it is less expansion for behavioral health services. And health navigators can bill for case management services and health and wellness services that they provide. And all the health navigators are hired through Aurora Mental Health, and the reason we hired full-time health navigator is it is cheaper, because hiring outside interpreter is way expensive. They charge $50, $60 an hour, where we are paying our navigators $15 an hour. Oops, sorry. And here is our awesome navigator. We have 9 navigators, including myself, as their supervisor, and I speak Nepali. So among all the navigators, we covered 14 different languages, which are the top languages that we serve in the refugee clinic. And we strongly believe that our navigators are key to our success. And here are some of the things that navigators provide in a daily basis. They interpret for both medical and behavioral health appointments. They do, like Jan mentioned earlier, they do set up specialist care appointments, set up the transportation if needed for any of the appointments. And like Jan mentioned already, they always assist with the cultural training where they were teaching providers and mental health providers about what is appropriate in the culture and what is not. And They do reminder calls the day before of their appointments, which can decrease our no-show rate. And also the health navigator, they do often do home visit where if we can't reach the patient, then we go to their house, or if there is anything like health education or anything needed and where they cannot come to the clinic, we go out and do home visits. And then also health navigator facilitate groups. They do diabetes, hypertension, anything that is needed from the community. And then all the refugee can access health navigators through phone, or they can just walk in if they need any help. And I'm gonna hand it back to Jen again.
I just wanted to say a little bit about the funding model, because really it's not just that we love our navigators because they're less expensive. They're on the Aurora Mental Health Center staff, and it works really well because they can do a variety of different things. They don't just interpret, they do all the things that Banu talked about, and it's worked really well for us. But I wanted to mention the funding model because navigators are not easily funded through billable Medicaid services. Especially on the medical side, there really isn't funding for that. Now, as Banu said, we can bill for case management, outreach, health and wellness, so we are able to bill for some services. But we've had to do some creative braided funding to make this model run and keep it sustainable. We had a grant initially to hire some navigators, and when it ended, we had to look around for how would we continue to do this. And one thing that has turned out to work terrifically is we have been able now to bill our primary care providers for the interpretation that the navigators provide and bill the state for the interpretation they provide in the screenings, so that in 2016 we brought in $132,000 in interpretation funding, which really goes a long way to roll it back in to pay for the navigators. And then we continue to get grants, and Medicaid can be billed for the integrated services on the mental health and then the medical side as well. So thank you very much.